For Bajeti Hub, we took a note that this was going to be a game changer in terms of investment. An important aspect of it is that all service delivery is local. It doesn't matter at what level you agree on the norms, on the standards of, say, healthcare, of agriculture, of water, food security, for instance, of dealing with poverty. All these, you can discuss them at a global level, you can discuss them at the national level, but finally, they have to be implemented in a geolocatable place, because that's where citizens live. And therefore, our work has been to engage through citizens, engage with governments, to answer a very simple question. Are we putting our public money, basically money that we collect from tax revenues and even what government borrows on behalf of the people, are we putting it to the needs of the people at that level?
From a children lens, because as UNICEF we focus on children, so when we talk about localization, it's talking about that child in the village, in the town area, how they are doing, whether they are actually getting the services like water, like education, like health, for them to get their full potential. And there is somebody who is responsible for delivery of those services. In this case, the government of Kenya, both national government and county governments. So localization is about how the Kenya government at the local level is actually accessing those services to the child.
In terms of ensuring that nobody is left behind. And so the counties really are the regions where we can really be able to test whether what we're doing and what we think, not just as development actors, but also as a country, are being realized.
Accelerating the SDG localization in Kenya, the program, is part of the broader joint devolution program, which looks at 3 output areas: the legal frameworks, ensuring that there is inclusion, public participation, and also data knowledge management. Now, this SDG localization, you realize, is a very critical aspect of ensuring that inclusion and equality is realized at the county level, because it's at the county level where we have delivery of services like in health, in education, in water, in all those services, they are delivered at the county level. So it is important that at the county planning level, where they do the county integrated development plans, that these aspects are catered for at that level. They must collect data to inform the gaps, where we have gaps in these SDG localizations, specifically address the gaps, especially in service delivery in the social sectors, where women and girls are most affected. Talk about health, maternal health and all that. Adolescents, yes.
One of the things that informed the SDGs that we get to look at the county level is, first of all, the functions of the county. So the 3 that we've given prominence to is the first SDG, so SDG 1 around no poverty. It cuts across because the reasoning is that when you allocate resources towards programs that are in line with this, 3 these sectors or thematic areas, then you are gradually or increasingly alleviating poverty. The second one is SDG 5 around gender equality. First of all, are women represented in decision-making processes? When you look at the county government side, the actors there, the county executive committee members and all that. The other one is, are women represented when it comes to public engagement processes? So when you look at public participation processes, are they among those who are giving input and subsequently influencing decisions? Third one that we're also giving prominence to is the SDG 16, and particularly looking at the target 16.6 and around budget we call it budget credibility, because it is essentially assessing the level to which governments are able to spend in line with what they have approved.
Budgets are supposed to achieve certain service goals, right? Whether it's immunization, number of children who are growing healthy with proper nutrition, number of children in schools, number of households with access to clean water.
For us in Nyeri, it's around health, which is SDG goal number 3. And so for us, what we do is now we track the budget, we track the allocation for NCD drugs, and then the solution that they came up with was to advocate for the amendment of the HSF Act, the Health Service Fund Act, to ring-fence resources going towards the NCD drugs.
Sia County, we've quite engaged extensively on SDG discussions. The work that we do directly contribute to a lot of things on SDG. As an organization, we work majorly on health, and our workers have been on health advocacy, which is I think the SDG number 3 on good health, where we've been able to do like around 17 community scorecard interventions. And beyond that, we've also been able to do budget advocacy work on health. I think the work that we do on a day-to-day basis with the people we engage with, is all around SDGs.
In Kwale County, we had the bursaries, so they were helping with education. And then we also pushed for the Kwale County Sexual and Gender-Based Prevention and Protection Act. We were also pushing for the safe houses for women who have undergone gender-based violence and anybody who has undergone gender-based violence.
The county integrated development plans, the 5-year plans. I think for most counties, they do try to show linkages at that point. One of the requirements of that is that every county plan should be, linked to other existing plans. And so you find that certain counties will outline these are our priorities for the upcoming 5 years. And in terms of the existing plans, this is how this priority relates to, for perhaps the Vision 2030 plan. And this is how it relates to the Sustainable Development Goals.
So SDGs is also for a long time been seen as this thing that the government of Kenya made a commitment. So it's a national government thing. It is not seen necessarily as a county government obligation and responsibility, as it were. I think for me that's where I see the main challenges.
There are many gaps in terms of aligning the documents that should be guiding us so that we're able to monitor and to report and to be able to tell whether we're on track or not.
So utilization of the evidence is a very big gap. The knowledge of the policymakers of that evidence is a very big gap. And also the basic understanding of the return on investment in terms of when you invest, for example, in early education, what does it mean for the importance of growth of the family and the society, and Kenya at large. There's that misunderstanding.
When we were developing this tool, first they were the primary. So first we mapped out all the indicators that we wanted to see from these budget documents. Like, this is what we expected to see. And after that, of course, they were able to go and use that tool. So in the 2025-2026 financial year budget estimates, that's where they applied this tool. But in applying this tool, of course, they were able. Sometimes you were able to identify for this one, there are gaps even within the tool, which the tool was. We are in process of proving that tool based on the engagement. But already it's already accepted by these facilitators and of course the regional budget apps, which they're also working together. So in accepting this tool, of course, it means it's a plus already, which they are also able to. For instance, they are able to first to check the allocations maybe in previous years, what has been done, noting the progress. Because remember, the main goals of our sustainable development goal is usually the progress. What progress are you, like how do you track progress over time? And for our facilitators, I would say they have already accepted this tool to apply it, and I think it's also easier. Like this tool is like it connects to what they have already been doing. So they are already trained on budgets, and they're able to really observe this tool easily because they already have that capacity.
I believe the tool is helping us be able to track budgets and programs and really gauge where have we come from, where are we going to, and then really the interventions or initiatives that we really need to put or take moving forward.
This tool is actually helping us in what we are calling intentionality in our work, so that now we're able to track per county the area of interest, then we're able to track progress, what is it that is lacking, what is the gap, and then the budget facilitator and the champions, they're able to now be more intentional in their budget advocacy.
It has started already to open my thinking about the SDGs, because I was doing budgeting but I was not focusing on the SDGs.
I hope and believe that we are going to key in the correct data, the real data. If, for example, the youth were allocated for like 1 million for a particular activity, let it be 1 million, not 900 or 1 million point one, you know. So we are really looking forward to having this tool in place, and it's going to help us in documenting and making work easier.
For that, I've never come across such tool for tracking the SDGs, but the information that and the skills that I got for the last yesterday and today, especially for the session of that been taught yesterday on tracking of the budget, I really appreciate. I never knew that, because when we were doing the group work yesterday, there's a lot of information that I got it using the tool itself.
The tool that you have developed tracking tool for the budgeting with the gender responsive planning and the budgeting is very, very critical. The civil society has very good capacity to support the process for gender responsive planning and budgeting. So there's a very big opportunity that now there are these capacities out there localized at the county level, because the gender champions, these budget champions are living in the counties.
And I think what actually informed this is, you might find some counties have been doing voluntary national reviews, the VNRs, like self-reviewing or providing their progress and challenges on SDGs. You might find some counties are left behind. So for those counties which are left behind, it also directly connects to, it means their communities also are left behind in terms of reporting. And basically, that also could have informed that. And remember also, localization connects directly to participation. So when you don't involve communities, or you don't involve the people or the citizens of the country which government is supposed to be working for, it means you are already leaving them behind. They're not able to contribute towards when achieving those goals. And that's why public participation and involving them, getting their voices is the priority.
If we would like to improve the performance of Kenya as a whole, is to invest in children. That is what SDGs localization is all about. So county governments are essential. Everybody needs to rally around the county budget process to make sure it prioritizes children.
SDG dashboard, for monitoring of the SDG indicators was a good step, and it's a big success for this pilot phase of the SDG localization project. But within the bigger devolution framework, what now really stands to be done and of critical importance is the need for institutionalizing this process, additional training and capacity building of all the array of personnel at the county level, including the county planners and budgeting officers as well, but also strengthening really the mechanisms for public participation, and they're enabling the citizens to be able to hold the duty bearers accountable.